Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 14th of September. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Good morning and welcome back.
Anyway, in the United States yesterday, we had 61,000 positive new cases with a 29% decrease over the last 7 days, with our 7-day average at about 65,000 positive cases per day. Hospitalizations have decreased by 10%, and the death rate has decreased also by 8%. In Illinois, we saw 22,478,000 positive new cases with around 2,700 positive cases every day and about a 24% decrease over the last 14 days, with hospitalizations increasing by 9% and the death rate in Illinois increasing by 9% as well. Okay, so what can you tell us about, like, in the United States as a whole, we're seeing about 65,000 positive cases per day, and in Illinois, we're seeing like this weird increase in hospitalization and deaths.
Well, it's happening worldwide. I mean, the number of cases worldwide is going down. And there's two reasons for that. One is that the whole epidemiology of this is in waves. So it goes up, it plateaus, it goes down. The other thing is that, especially in the United States, where there are so many over-the-counter tests that are these antigen tests, that a lot of the cases are not reported. So it's for a combination of both things, but definitely the pandemic, however they count it, it's going down. Those tests that are reported, anybody that goes into a hospital or a certified laboratory, that automatically, no matter what kind of test you have, that gets reported. So, you know, it's a slightly flawed system now with this over-the-counter thing. However, it's going in the right direction. It is going down, and it's nice to see, especially here in Illinois, that the hospitalization rate and the death rate are going down. And all this is leading to a drop in interest in COVID in the population in general. People are generally basically thinking that, they're just not paying attention to it. This is over. And unfortunately, it's still with us, and we've got to be prepared. And as we're going to talk about later, there are some new vaccines that are available that could be very helpful.
Yeah. So Dr. Murphy, should we be worried about the fall?
Yes. There's been an uptick every fall since this whole thing started. And plus, with everybody back in school, everybody back in work, now work requiring in-person at the university, it's a minimum 3 days a week. But everybody is sort of coming back in some form, maybe not 100%. And transit riders are still way down from usual. I know I take the red line every day when I go to work, and I actually have a place to stand by myself instead of trying to cram in there with people. So it's not as crowded as it used to be. And there are people wearing masks, and nobody makes a big deal about it. You should wear a mask if you have any kind of underlying condition or you just feel uncomfortable in a crowded place. I would think in public transportation, that would be a good place to wear a mask, but it's an individual choice at this point.
Yeah, absolutely. Well, going into our first big headline that I think ties into the question I just asked you is that the White House is now saying to not wait to get the new COVID shot. So when should you get your COVID shot? When should people get their boosters, etc.?
Right. There's two scenarios. The first scenario is where you are in your whole vaccine process. The new shots should be taken 2 months or longer after your last shot, whether it was a booster or just the regular vaccine. You should get this new one, this bivalent vaccine. Bivalent means it's half of the old vaccine and half of the new vaccine, which is geared towards Omicron BA.4 and 5. So they're mixed together. So you only have to wait 2 months. Now, if you just had COVID, there's some other little caveats in there. And I think we have a question coming up with that in a minute. So I'll save it for them.
Wonderful. And now for our second headline that we shift into monkeypox here, that Los Angeles health officials are investigating the death of a person who has monkeypox. So what can you tell us about this individual who died and the death rate of monkeypox in
Well,
general?
there's some 54,000 cases worldwide and 18, maybe 19 with this case reported deaths. So the mortality rate is very low. But in each of the cases, the people were severely immunocompromised. They were either taking chemotherapy or steroids, or there was some very severe immune deficiency associated with that person. So fortunately, that's low, but it's still a risk out there. And this is being investigated now, but it should be no surprise. There does appear to be more serious disease in people who are HIV infected. There was just a recent report about that. And we'll see how much that really impacts it and what the status of those HIV infected persons really was. We don't know how well controlled on the virus they were, or what their CD4 count was, or their past history, how long they had it. We don't have any of that information, or I haven't seen it published anyway. But the good news is that the vaccines are rolling out with the monkeypox, and so far the U.S. has administered 460,000 monkeypox vaccines. Wow. And of the estimated 1.6 million people who have identified themselves as at risk, and especially those who are taking HIV medication to reduce any further risk of getting monkeypox. So they got a ways to go, but that's a big chunk of people in that group. So, and those cases are coming down too, worldwide and in the United States.
Yeah, that's great news. And now we have 3 COVID questions. The first one being, and referring to Paxlovid, do you have to be over 65 years and older to get Paxlovid? A friend of mine tested positive for COVID, called her doctor to see if she could get the prescription for Paxlovid, and her doctor is only prescribing her this medication for people 65 and over. I feel like this is incorrect, Dr. Murphy.
Well, that is not how the recommendation is for taking that medicine. The recommendation is 50 and over for just anybody, and 12 and over if you have an underlying medical disease or for some reason are higher risk for complications. So there's approximately a third of the population has one of those diseases. So it could even be hypertension, it can be diabetes, it can be prior cancer, it can be HIV infection, it can be a number of different things. It's well-published who's considered at high risk. So this is incorrect information from this physician. Certainly people over 65 have even more complications than people 50 to 65 or people with underlying diseases. I mean, that is good to give it to those people and to really encourage them. But there's still enough problems in those other groups that they should be taking Paxlovid. It's just 5 days. The government is still providing the Paxlovid. It's 5 days. It's very easy to take. There are some drug-drug interactions. You've got to ask the pharmacist, tell them what drugs you're on when they give it to you, or your doctor. But Paxlovid works. It cuts the serious infection complications by 90%, and it doesn't matter whether you're vaccinated or not, or boosted or not. So it's a really good idea to take it. That plus your vaccines, you're going to stay out of trouble with this disease.
Yeah, that's really wonderful to hear.
Mm-hmm.
The second question is, this individual tested positive for COVID in mid-August. And, there was this old advice to get your booster shot 3 months after. But with the reinfection rate of Omicron with BA.5, the cases are increasing, etc. When would you recommend individuals to get their booster?
It's a slightly complicated here. The official recommendation is that you don't have to wait any period of time before you get a booster that's scheduled. You just have to be recovered from your infection. So if your fever is gone and you feel fine, you can go ahead and have that booster or the full vaccine series at any time once you feel well. Now, many doctors have noticed that very few people get a second infection in the first couple of months after being sick, particularly if they were very sick. So in those cases, a lot of doctors say, well, wait 1 month or wait 2 months or wait 3 months. There's no formal recommendation. I generally tell people, get it when you feel better, but you can wait a month or two when you feel comfortable and go ahead and get your vaccine. So it's kind of a general recommendation and not the official one. You don't have to wait is the thing. You just have to be better. Mhm.
Wonderful. And now for our third and last question. This is about the bivalent booster, is that the Pfizer booster is half of the dosage of the Moderna. What should individuals be getting? Does it matter that it's half the dosage, etc.?
Yeah, it doesn't matter comparing the dose from one vaccine to the other. The way they are constructed and the way they've been tested, their doses don't match up 1-to-1. So don't worry about that. You're not really getting more exposure to the vaccine components with one or the other. It's really the same. The bivalent, there's just a little confusion here. Bivalent vaccine is 50% of the old vaccine, the original vaccine, and 50% of the new vaccine. So you get protected against all the former variants and the new variants in one shot. So that's what they mean by the 50%. I think there's just some confusion here. It's a confusing story. I don't blame anybody for it because, the pundits are throwing these numbers around 50%, this dose, that dose, like what the heck's going on here? No, the important thing is to get this new one and get it as soon as you can. If you're eligible, which practically everybody is, 12 and over, get it as soon as possible because we're expecting this peak, another fall peak, and winter peak. We had a peak last year in August, and then we had the Omicron in January. So we want to be prepared for that. And you also want to take the flu shot now too, because people are not typically wearing masks anymore, and they're back in crowded rooms and public transportation and schools. And so, our flu rate had gone way down because we were mitigating against COVID. But now, since we're not mitigating against COVID, all those things are going to come back. So, people are going to get sick with a variety of different things this fall. So protect yourself as much as possible and get the updated vaccine for COVID. Either one is fine. And also get your flu shot as well.
Right. Absolutely. Well, Dr. Murphy, those were all of our COVID questions for today. We will see you all next week.
Yeah, we'll see you next week. So we're back to our weekly presentations, and we'll see you then. Have a good week. Bye.